As we await a decision in the days and weeks ahead by an independent group of federal health experts who are meeting today to discuss whether to restrict eligibility for the Johnson & Johnson vaccine, which has up until this week effectively protected more than 7 million people in the United States from COVID-19. It's startling evidence of the uphill climb the Biden administration faces against vaccine hesitancy and baseless Republican cynicism in the form of one Tucker Carlson. The Fox News host last night questioned the efficacy of all COVID vaccines because experts still want us to wear our masks. Here was Dr. Fauci's response to that ludicrousness today.
That's just a typical crazy conspiracy theory. Why would we not tell people if it doesn't work? Look at the data. The data are overwhelming. In the 3 vaccines that have been approved for use in an emergency use authorization, I don't want to get into arguments about Tucker Carlson, but to me, it's just, you know, it's counter to what we were trying to accomplish to protect the safety and the health of the American public.
Joining our conversation, Dr. Irwin Redlener. He's the founding director of the National Center for Disaster Preparedness at Columbia University, and lucky for us, an MSNBC health policy analyst. Kimberly Atkins is still with us, and she has some important insights on this, too. But I want to start with you, Dr. Redlener. We showed you that because what the J&J example shows is, I think, the opposite. The minute there was information about even a small number of people having a medical reaction, a crisis, that was instantly shared with the public. I mean, what is Dr. Fauci up against in terms of really undoing some of the disinformation that's been spoon-fed to some groups in this country?
Yeah, Nicole, this is a very interesting situation. It's like this major shock to the system that we actually have a government, a federal government that's transparent, honest, and competent. And I guess that is, I guess, hard to take a bit. But the fact of the matter is that I'm very reassured, and people should be reassured, that we're dealing with a government that cares, that wants to communicate honestly. So when there would seem to be potentially a problem with the vaccine, it was released immediately, and it's being dealt with. So I'm feeling very good about it, honestly. And, you know, people like Tucker Carlson are really undermining the ability of our country to get a handle on this pandemic. It's really a shame, Nicole, but I'm glad that the government is doing what it's doing, letting us know. And I spoke just a little while ago today with Dr. Walensky, the head of the CDC, and asked her to tell me some more about why they are releasing this data so promptly. And she said there were several reasons. Number one is they wanted the public to know that they're being transparent. Number two, they want to make sure that people and doctors who are observing this complication of blood clots are reporting them immediately. And thirdly, there's actually a treatment implication because typically blood clots might be treated with a thinner called heparin, but in this case, it should not be. So those are the reasons, and it's being evaluated as we speak.
I feel like you should have transferred her to Kim because Kim had the J&J vaccine. Kim, you've written about it today. I want to read from your piece, and then I want to ask you about it. You write this: if I had to do it over again, I'd get the shot without hesitation. I want others to view this pause not as reason to doubt the drug, but a reason to believe in it. I understand how people, including many African Americans who have well-founded suspicions about whether the health care they receive is inadequate or laced with inherent bias, would find this news unnerving. But I think about my mom, who was wary of COVID vaccines until a source she trusted, Dr. Anthony Fauci, got it himself. She and my dad are now fully vaccinated. First of all, you had J&J. You decided to write about it. Just talk about how you feel, not just covering the story, but being part of it.
Yeah, well, I feel great physically. That's a good point. And I got it about a week ago. And when I heard this news on Tuesday from the FDA and the CDC, I thought, oh, no. I didn't think, oh, no, because I was worried about my own health, because I know that although it's really tragic that these 6 women between the ages of 18 and 48 got this blood clot and one died, I know that for the 7 million people, including me, who got this vaccine is 100% effective against hospitalizations and death from COVID. And I was terrified that it would cause vaccine hesitancy. I could understand why it might, because we've gotten so much information over the last year, So much of it has been contradictory and confusing. And I just wanted it to be as clear as possible that although it is good, it's good that this stop happened. It shows that safety protocols are in place. But if it does last just a matter of days, as Dr. Fauci says it might, and I hope that it does, I really want people not to hesitate at all to get it. For me, it was the best choice for me among the vaccines. I wanted it done quickly. I wanted my immunity at full level as quickly as possible. I got a wedding next month.
Yeah.
I have like 14 jobs. I have a lot to do, and I don't want to go back for that second shot. And I want other people for whom this shot is the best one for them to have access to it. So that's why I wrote this column.
Kim, I just want you to keep talking. I mean, let me just throw out some data, and I want to let you keep going. I mean, the truth is the J&J vaccine is, I mean, you were drawn to it because you're so busy. A lot of people are drawn to it because it's a production to go in once, let alone twice, in places that don't have easy access to pharmacies or it's a drive. It is just easier. Of all of them, it's really disappointing that this was the one that was going to have this small issue. Can you talk about that side of this?
Yeah, and that's absolutely true for people who live in rural communities, for people who have health, childcare challenges, gig economy folks. It's a good choice for them if getting that second vaccine would be arduous. And we've already seen people when the initial efficacy numbers came out, and the efficacy numbers for the J&J vaccine was in the 60s as opposed to the 80s or 90s for the other ones. And people saying that this was the less valuable vaccine. Even for a brief period of time, the mayor of Detroit, my own hometown, rejected the J&J vaccine. He later accepted it, saying that he wanted the best for his residents. This is the best. This will save lives, particularly for people who are most vulnerable. So, you know, I only have my words to share, and I hope that they are helpful to people. I will say all over the place, I'm thrilled that I got this vaccine. I'm glad I got it, and I hope others can.
I never get enough of your words. Dr. Redlener, I want to come back to you, though. The full picture on our vaccines is one, truly first world circumstances that we're so blessed by having 3 vaccines. But by far, the vast majority of America's vaccine supply is Pfizer and Moderna. By far, the biggest bets that the Biden White House made were on ramping up supply of Pfizer and Moderna. And I'm told that people that had appointments for J&J, if they want to keep those appointments, there is in most cases, the prospect of getting a Pfizer or Moderna shot instead.
Well, I don't think it's actually dead. And by the way, Kimberly's words, I cannot overstate how important it is that that message get out. I'm so glad she did that. And but I think the reality is that there will continue to be large supplies of Pfizer and Moderna, but also I do think we're going to see a return of J&J at the maximum manufacturing capacity, and it will again take its place among the choices that Americans have and people around the world have. And I think that's good. And everything needs to be kept in perspective right now. Look, the downside of having this pause is that it might undermine people's confidence in vaccines in general. But overall, I agree with the CDC's decision and look forward to the further deliberations of the Advisory Council on immunizations. And I think we'll, in the next couple of weeks, maybe be back on track with J&J. But I would personally take that vaccine. I would allow my children of that age range to take the vaccine. Not that I have any control over what they actually do, but I would certainly advise them to do that as well, just like Kimberly did.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.